Talk 100.7 FM.
There it is, 9:42 on the Talk of the Town, Talk 100.7 FM. According to the big voice guy, Jay, Rocco, and Mark, and we're all in studio now that I can see. Here, Rocco, is that all right? I can't see you. We have all the lights off there. Sticking my hand out.
All
right,
we're in the dark here. I love this. This is Talk After Dark.
This is. I can't see Dr. Anita at all.
Hi, that's because I'm all tan.
You got her bright yellow
my
on.
sunscreen. Yeah, I put this bright yellow on.
It's more so because, well, we have the studio lights off. We have the office lights off. Everyone was, what happened? What happened to the lights?
Power outage.
Yeah.
Leland Ave.
Nope, the doctor brought some equipment in, so we need the lights off for the experiment, I guess, here this morning.
So, yeah, I asked, welcome back, Dr. Anita. I asked you, because I had seen these commercials for, I forgot
It's
who
Walgreens.
it's for. Walgreens,
yeah, I think
okay.
Walgreens says it.
Yeah, they have all these people that have all these skin spots on their face, and there's some sort of light on them, and you can see all the skin damage. And some of them have more than others, I would assume. So I thought, well, you always are coming on talking about skin stuff and skin damage, so I figured you'd had something like that. And you do. You have a portable black light, a purple light here. That's why we have all the lights off in the studio. And I was hoping you could bring one in, and you did bring it in. So you can explain a little bit about what that is and how it works. And I'm not sure, Jay, I didn't want to steal from where you were going with the conversation, but that's why I had her bring this light, this toy to play with here, because I think that there's a lot we could talk about. And it's something that you do at Laser Spa at 610, right?
Yes,
right.
we can do this in the office for our complimentary skin consultations. It's really it's an adjunct to help us assess the tone, texture, and extent of sun damage on the skin. It was, also used by dermatologists for detecting bacteria, fungus. You can see other skin irregularities, like for fungus, for example, things will light up like ringworm, which is actually a fungus. It's not an actual worm, but you can see the extent of sun damage. And you can't see the depth per se, but it is really alarming. When you look at your skin, even in that Walgreens commercial, everyone looks pretty normal, and then they go under the black light or the UV light, and they look like The Walking Dead, like zombies. All of a sudden, you see all this,
right.
and they're still very
Your
beautiful,
skin's all
but you're just like,
right,
it's startling, and people
right.
don't realize the extent of sun damage that's happening just even with one trip into a tanning bed, and your lifetime risk of melanoma or sun-related skin cancer is up by 20%. So that's an alarming statistic.
Yes,
when you think about it. So this is kind of a nice way to give someone a wake-up call and say, hey, it is time to wear your sunscreen. But more importantly, highlight any areas that need further sampling, like with a biopsy.
So you did, before we came back on the air, you were scanning my face or lighting my face.
Your face lit up.
Yes.
And it was so lit. No.
My teeth were really lit, but I had to keep my eyes shut, so I don't know what you were all doing. You could all have been making faces at me.
We were drawing on your face with a permanent marker.
Do I have my face now?
It's something it's all over your face there.
So did you see anything in the light on my face? Did you see anything that would be of any concern that is beyond just, I guess, the normal skin damage that you might see on someone? I know you were doing our boss as well before as well. And so I don't know, your reaction to me was a little different than him, so I'm a little concerned.
Oh, no. Actually, it was just too short of a period of time. Okay. In the office, it's a controlled setting. We set usually a long period, like at least 30 minutes to an hour for a full skin consultation. This wouldn't replace your examination by a dermatologist, but we do refer to dermatology if we see something that's at all concerning. So for your face, just to look at you without the wood lamp, your skin looks fine. So, it's hard for me to really send home the point, okay, you need to wear more sunscreen. I can tell that you're tan, which is not a bad thing. Everyone likes to look tan.
He was out there on the water all day the other day,
right.
Doctor.
But if you
with
could
no
see, and I'll let you put this up, I'll let you see my skin under this. And even my skin lights up, and I'm religious, like to the point of obsession with sunscreen. So because I'm already tan, so why bother with more sun exposure? I don't have to age if I don't want to and throw more sunscreen on. But your skin has a lot of irregularities. Nothing like that really was very concerning, but definitely warrants further investigation.
Well, now, what do you mean an irregularity? What would what is the irregularity that it could be?
There are parameters that we follow for lesions when we see sun damage, which most sun damage has been, the blueprint for the sun damage has been set by the time you're 18. 60% of it has been set by the time you're 18. The remaining 40% you can control by wearing ongoing, by being proactive with your sunscreen.
It's been set by the time you're 18? You mean your exposure to the sun when you're
all
under
the
18?
years of cumulative sun that you've acquired till the age of 18 has created sun damage that may manifest 10, 20, 30, 40 years later. So some of the things coming up on your face now might have been something that was really set back
When you were
Not like from the past.
So your
weekend.
baby face for a while.
Baby.
Baby face.
Yeah,
I'll have you look at my face afterwards. I probably had more sun exposure than anybody in the room.
You certainly have,
so that's
Mark.
not baked in.
So you can look in the break or something.
She's going to do a
Look
fully
check
disrobed
mine.
one too.
So,
Well, it's
Doctor,
also-
no, so, well, I didn't mean to cut you off. No, go
No,
ahead.
no, you're good. I mean, it's what you to answer more fully your question. It's looking at all the parameters that we look at when we're looking at a lesion on your face or any spot, or people call it liver spots, age spots, sun damage. It's all the same thing. It's all the end result of cumulative sun damage. We are taught to do the ABCDEs, like is it asymmetric? Are the borders smooth? Are there color irregularities in it? So those are things that are more highlighted with the Woods lamp, so that we're able to assess them better because it goes a little bit deeper than the naked eye.
So I guess that starts to answer my question. Where does it become? So as Rocco said, you scan my face, and Mark says, try mine because maybe I've had
Look
more
at me.
sun exposure.
When take the break. Okay.
When does it become, I don't want to say problematic, but when does it become a concern or an issue or something to start to address?
Well, kind of along the lines of what I just said. Like
Right.
if it's asymmetric, if it's more than one color, if the borders are irregular, if it hasn't been there before, if it changes in its own nature, like if it's been flat but now is raised and bleeding a little bit, or if it's itchy and you're scratching it and it's bleeding, or if it goes away and it comes back, that's something that says, hey, check me out, because
Anita,
it could be more concerning.
when you see older people, they have spots, darker spots on their skin, and some of the people don't look like they really have been in the sun that much. Is that something that occurs with a natural aging process? I know people refer to them as age spots, liver spots, sometimes here.
And then there's also actinic keratosis. There is still
Even if a person were
We're
never
not
exposed to
tanning.
the sun, would that person still get those spots as they get older?
Probably. I mean,
Yes.
but probably to some extent. But remember, there's no one that's not really in the sun unless you live underground. So
Well,
there's
but parts of your body are not exposed to the
Parts
sun.
of your
Some
body.
people like me wear clothing and
well,
those
most
parts.
people wear clothing.
I mean,
We have
but I mean,
most of the
even when they're out in the sun, they have
Dr.
this-
Anita has
they
clothing
have
on here
some
this
clothing.
morning. Rocco.
Always
Yeah.
make
Yes.
it a
Yeah,
good
Rocco
rule
has
of thumb
clothing.
to leave the
There are
house with
parts-
clothing on.
We've all participated.
Right. No, but you are right. Some of it is not sun related. But in terms of in terms of the liver spots, sunspots, some of it is just not sun related, but the sun related stuff we do. What I was about to say was, we get exposed to a lot of ambient light. You don't have to be laying out in the sun with baby oil on your face to get sun damage. We go to and from the car.
Yeah.
That's a lot of light that you
Well, even
add
riding
up.
in the car.
And you're riding in the car. If you're the passenger side, you're getting more on your right side. The left side, most people are getting more sun exposure cumulatively in their lifetime from the left side because we're driving. But I did meet one lady, and she only had damage on the right side, and she was older, and she's like, I never drove. My husband drove me everywhere, and you could read it on her face. You could tell. And a lot of times, more of people are doing a lot of age preventive stuff in the office, but it goes deeper, like the Botox and the fillers. But if you're not taking care of what's on the superficial surface of the skin, everything gets a little bit more etched in sun damage or sun dried skin. But to answer your question, yes, there are spots and things that come up that are not related to the sun, that might be related more to your internal metabolism, that would require further evaluation. Like if we start to see a lot of angiomas, you think, oh, what's their liver function doing? They're little triggers that we
What's
as
an
clinicians
angioma?
can. Little little cherry spots that come
Okay.
up on your, and those aren't sun related. Those are more, hey, is that person on hormones, or is there something going on with their liver?
So that's why they call them liver spots, because something goes wrong.
No, those are
something
different.
happens-
No,
those
liver
are different.
spots. I don't even know. I think because they look like liver. I don't know.
Oh, really?
But yeah, I mean, honestly, like the liver spots, it's kind of it's a slang nomenclature that came about a long time ago, just because of how it appeared.
Is that a
and
medical
sound.
term, or is that just a layman's term?
That's a layman's term.
It's strictly layman's
Yeah,
term.
Do pilots? I read somewhere that I think because pilots are higher in the sky, the closer you are, although it seems like a silly distance, the closer you are to the sun, and without any obstructions of clouds,
Right.
the more direct sunlight you're going to get and be exposed to. So do you ever hear, do pilots wear a lot of sunscreen or something? Do they face a greater risk because that's their job every day in and day out is flying facing the sun through these big windows?
100%. Yeah, they are absolutely at more risk. But it's funny when you talk to them or you hear about them, and they are really progressive for the most part. Most of them say that they wear their sunscreen all the time. And it's easier when you're feeling it right on your face. I imagine when they're flying it, they're feeling it right on their face. So it's easier to wear your sunscreen. Even in patients who've just been lasered, it's easier for them to remember their sunscreen post-treatment instead of pre-treatment, even though it's both equally, if not more important, to avoid the sun before any laser treatments, because you can actually feel the heat on your face and say, wow, I better get something on.
Oh, right.
But in terms of clouds, I will put a little caveat in there. You're still filtering UVA rays through clouds. So on cloudy days, sunscreen is still important. You're absolutely right. The fact that they're closer and they have less obstruction and they are more likely, they're getting more exposure.
If you've been exposed to the sun, say you've been out and you've been exposed quite a bit, is on a particular day, is there anything you can do at the end of the day to reduce the sun damage that would be caused? Or once you've been exposed, there's nothing you can do about it? You can use products or moisturizers. Does that help? Does it? It's too late.
I like to talk about my trifecta of sun protection. We always talk about sunscreen, but there's things that you can do to prevent sun damage if the sun exposure has occurred or is about to occur.
Yeah, talk about that a little bit.
We talk about antioxidants a lot and topical agents. You think, oh, what's a cream really going to do? But you can get topical vitamin C, topical vitamin E, and those are antioxidants that bind free radicals after they've already formed. And free radicals are formed when the sun hits skin, and these free radicals are looking to become more stable. They're unstable molecules that are looking for stability,
damage, right?
And they take that stability from your skin, from the cells in your skin.
Right.
So, and that creates damage. Now,
what
the
about
other
if
thing
you
is,
if you ingest antioxidants, would that help? Like
that
eat
helps too.
blueberries,
Yeah,
things like
you can.
that?
Yeah,
Yes.
eating, everything, beauty from the inside out, and health from the inside out is absolutely key. 80% of the equation is nutrition. So, doing antioxidants in your diet and through whole live food is absolutely very important. But some of it isn't going to get to the level of the skin, and that's why certain things like topical C and topical E are very important, because you could ingest huge amounts and still not get enough to the lever to your layer of skin. So doing a topical C and E to bind the free radicals after they've already formed is important. And there's ferulic acid, which I'm surprised once it came off patent for SkinCeuticals. I'm surprised it's not in everything, because it's actually a photoprotectant, different from sunblock, that gives you 8 times photoprotection from. It actually prevents the free radicals from forming. So if the sun is hitting your skin, the ferulic acid is preventing the free radicals from forming. If the free radicals have formed and are attacking the skin, the vitamin C and the E in the skin is helping to bind the free radicals to prevent the damage. And then the sunscreen is the topmost layer, where you're just preventing the sun from getting there in the first place. So.
You guys want to try this? Is that should we? Or is that?
Yeah.
Should
I want
we,
you to look at my
It's
face
not
and-
painful. It's
Tell
not
me how
painful,
bad I am.
and there's no risk to it.
well, we won't have much more time. But
Ferulic acid. I like that.
you want to do it during the break? Is that what we want
Yeah,
to do, or do
yeah.
it on the? Okay. Well, I can take a quick break, and
Take a
we'll
break and you can-
we'll come back and we'll find the. You sure you want to know
Tell
the
me how long
findings,
I'll be
Mark?
around.
All right, stay tuned. Dr. Anita Amadon in studio from Laser Spa at
I
610.
always laugh about it. Oh, you only have 7 months to live. I was like, no doctor in the beginning of
Where was the trouble spot?
no real trouble spots. I thought about a spot like on your nose,
Oh, right
but it's
here,
where
yeah.
your glasses are, and then when I pull this away, I could actually see it on here. So it's, but that
Oh,
I
it's
would
just
use
more of the
right
shape,
away.
yeah.
So it's
Natural beauty affects late. Reserved now for any time of the summer. If you're
That-
looking for a low-cost, old-fashioned
All right, but you want to close your eyes.
Is that light too bright?
Let me see.
I could turn the
No, it's okay. It's okay. I can actually angle this way.
Good. Am I good?
It's funny because you can actually just see, like a lot of the white flaky stuff is just dead skin. So most everybody could use some exfoliation a couple times a week. So this is the white stuff that you see light up. That's not concerning at all. It's just dead skin. Exfoliation twice a week should take care of that. You also want to tell people no makeup, no oils, no powders before you do the examination.
I didn't put any makeup on yet.
Not yet.
It seems like restaurants are always
And
raising
then
prices,
actually turn towards me just a
downsizing
little bit.
portions, and often leaving you feeling hungry.
Oh, Mark, look at that spot on you.
Right unwelcome.
Nothing bad. I mean, you'll see a lot of reds and whites and browns, and so even though you're tan, it just shows that you're not homogeneous. You're not homogeneously tan under the light, and so you can see areas that if I were to go say, oh, I better sample like this. I don't know if you can see it, but right here, that's probably a sebaceous hyperplasia. There's a little yellow behind it. There's vascularity on top. Sebaceous hyperplasia, very common in more tan skin because we have more oil-bearing glands, and it's filled with sebaceous fluid. In the past, you could just surgically excise it, but that leaves a big scar. It's not at risk at all for cancer, so it doesn't bother me unless it bothers the patient. But there are lasers to treat it, but it could create scarring in someone as tan as Mark is. So I mean, that's something that does
You have a sebaceous problem,
right?
Mark.
It's not going to damage
But
it,
see,
is it?
oily skin is younger looking skin, so it's not, and it's not that your skin is oily. I'm just saying, like, you definitely have more sebaceous glands. But aside from exfoliation and moisture, like you can tell that the skin's really dry, a little congested because you probably had sun exposure over the weekend. Like you can see acute versus chronic congestion. I don't know how to describe it. Really, like looks more red and more angry,
Mark,
and then turn towards me.
your skin's angry.
But I don't really see any
Look at all Mark's
discrete
gray hair
lesions that you
coming out.
definitely need a biopsy of, so that's good.
You do not.
No, not right now. But with the caveat that everyone should get a skin check, scalp to toe, once a year. So you still would need like a clinician's eyes looking scalp to toe to see if you need anything biopsy. But I didn't see anything on here, so yay. Oh, Ken is pacing. Is he okay? Like,
Well, thank you for
are we
doing
going back? Are we?
This is the last spot. Then we got about a minute.
Judy King Insurance, St. Johnsville. Hilltop Tire, Fort Plain, Pleasant Lake Inn, Stratford. See our website for the full list. Brought to you by the Montgomery County Office of Aging, Peaceful Living Home Sales, Oneida County Tourism, and Rozier Communications.
Maybe I'll take a picture of you with like,
With it on?
Yeah,
With my skin?
Oh, look at that.
All right, we got about a minute or so. What are the findings on Mark, Dr.
It's really
Anita?
fun to use a whiz lamp now. Actually, really homogeneous skin. I didn't see any discrete lesions. Did see a lot of the stuff lighting up is just skin that needs to be exfoliated. Everyone should probably exfoliate twice a week, and you still want a dermatologist to look at your scalp to toe to identify any other areas that might need to be sampled. But I didn't see anything obvious that needed to be sampled. But there is evidence there was acute congestion that looked like you probably had sun exposure this weekend. But
That's a good guess.
Yeah,
that's a good educated guess.
Dr. Anita Amadon. Check her out, Laser Spa at 610 French Road in New Hartford. Doctor, thank you as always for coming in.
Thanks for having me.
Thank you.
Stay tuned. CBS
Lots of
News, the local news, and Glenn Beck coming up.
Broadcasting from the Bank of Utah.